Nothing for me without me. That's a personal philosophy I've tried to use throughout my career as a physician. My name is Don Bukstein. I'm an allergist and pulmonologist in Milwaukee and Madison, Wisconsin, and a real advocate for shared decision making. What is shared decision making? Who needs it? What is it about? Where do we use it as a medical team? Well, let me give you an example. If you have a cut and it's bleeding, you need a Band-Aid, not a shared decision-making aid. But for certain chronic medical conditions, there are many choices, both in diagnosis and especially in therapy. So we have to make a choice, a decision between different options. And patients have preferences. You have a preference. Which type of treatment do you want? And chronic diseases are the perfect venue for using shared decision making. What is a shared decision making tool or aid? Well, oftentimes we script certain messages so that we as physicians, doctors, and our staff and others, such as community health workers, athletic trainers, anyone in the medical team can work with the patient to really get them to understand the choices they need to make and be able to combine their preferences for therapy into an action, a decision. Why do we do this? Well, we want to make sure that each patient understands the benefits, the risks, the options, and the burdens that choosing one option over another may place with regard to themselves and their families. It really is a journey. It's a two-way conversation between a physician and a patient so that the patient really understands those options. These are scripted because we want to make sure that the patient understands the different choices. Let me give you an example. Dan is a 30-year-old young man who plays pickup basketball in inner city Milwaukee, and he falls and injures himself. And he goes to the physician, and the physician says, "We need to do surgery right away." Well, Dan has a problem. He has an elderly grandmother that he takes care of and a handicapped brother that he takes care of. Having surgery would mean time in the hospital away from both his grandmother and his brother. So Dan asked the physician what other options he has. The physician may send in a nurse or medical assistant that goes through a shared decision-making aid to let Dan know the options that he has. Well, Dan knows that he'll be better in 2 or 3 weeks if he has the surgery, but if he gets intensive physiotherapy or rehab, it may take more than that, 4 to 6 weeks. But he can do it over telemedicine so he can be at home to take care of his grandmother and his brother. This is an example of what may be good for Dan may not be good for someone else. So it all comes back to where I started. Nothing for me without me. In each patient, each one of you deserves to have all the options explained to them and be able to use their own preferences to help the healthcare team, your doctor, and others in the team make a decision that's best for you. Thank you.